Thank you for joining me today as I cover the basics of sensory processing, the relationship between sensory and behavior, and how everything is all connected. My name is Bisogni. I'm a licensed occupational therapist from Bothell Pediatric and Hand Therapy. I've been working with kids for quite a while. Even before I was an occupational therapist, I have a lot of experience working with children with all kinds of disabilities and abilities, all kinds of different sensory needs. And my biggest takeaway from working with all of these children is that everybody's body is different and we all have different sensory needs, and it can really affect us drastically if our needs are not met. So it's incredibly important to understand um, the underlying factors of sensory processing and what can happen if sensory processing is different than how we would expect it to be. This is a great quote that I like to start off my presentations with. It's the little details that are vital, because little things make the big things happen. And I think this is especially true for sensory processing because there are so many factors that go into it, and there are so many little nuances. What can be one type of sensory stimuli, like auditory stimuli, can be really aggravating for somebody, but they could be totally okay with tactile stimuli. So it's my job as an occupational therapist to pay close attention to the little clues and signs that kids are giving me for sensory processing in terms of what they are okay with and what they aren't okay with. And that way I can help them meet their needs and help them feel safe and comfortable in their sessions so they can get the most out of their time. And this is applicable, of course, outside of OT as well, because if there's in general a child who's having a hard time with something, it's our jobs as parents, caregivers, just anybody really who's in the child's life to pay close attention to what the things are that's giving the child a hard time so we can step in as their caregivers and help them be successful in their environment. Here is everything we will be talking about today. In regards to sensory processing, we'll be talking about some of the underlying causes of sensory processing, what's happening inside of the brain that could cause a difference in someone's sensory processing, which would therefore result in differences in behavior. We will talk about sensory processing disorder components, so the more of the biological aspect of it. Then we'll talk about signs of sensory processing disorder. This is where we'll talk about how it manifests when there is a difference in the brain in sensory processing. And it can look very different depending on what about the sensory processing is different. Then we'll talk about sensory processing as a diagnosis, what the criteria is, when as a caregiver, you would want to seek out possibly obtaining a diagnosis from a physician. As an occupational therapist, as a disclaimer, we do not diagnose. However, we are very aware of what the criteria are for diagnoses that we work with very often, like sensory processing disorder. And since we are the people on the front line, so to speak, of children who have this disability, we can pick up on this pretty quickly or easily, or more easily than other healthcare workers might. So we can make recommendations for diagnoses based off of our observations. Then we'll talk about sensory processing disorder and behavior, how those are connected. This is an area that I hang out in a lot as an occupational therapist in my day-to-day life. There's a very strong connection between sensory processing disorder and behavior. We'll talk a little bit about that. Then we'll cover some tools to maximize daily success. These tools are pretty effective in kids with sensory processing differences, and also it can be applied to kids with other challenges as well. And then last, we'll talk about when the right time is to seek help from a professional, like an occupational therapist, or maybe another supporting area. So what are the underlying causes of sensory processing disorder? In order to understand this, we need to know what sensory processing really means. Sensations are our way of learning about the world around us. As soon as we're born, we are instantly bombarded with brand new sensations, and we will continue to be bombarded with brand new sensations as we continue to go through life. However, over time, we start our bodies and our brains start to realize that some of these sensations are the same. And we experience some of these sensations we experience every day, and some of them we experience every hour. So the more often we experience these sensations, the better our bodies become at predicting how to react to these different sensations, and our bodies are able to more easily suss out which sensations are dangerous and which ones are not, and which ones we like, and which ones help us feel calm, and so many other feelings. Our sensations give us energy and knowledge, which is our input, and then they'll direct our bodies and our brains to give us a response to it. So, for example, the first time you try a new food, like an apple, the first time you bit into an apple, you might have noticed before, maybe even before you bit into it, the color of it. When you held it in your hand, you probably noticed the texture. Maybe it was, hopefully, it was pretty firm, not too soft. And then you finally bring the apple to your face, and then maybe you're able to smell it a little bit if it's ripe. Then you bite into it. Now you've had all the sensations. The second or third time you had an apple, you probably had a little bit of a better idea of what to expect. So having an apple is no longer a novel experience for you. And maybe now you've realized you like apples, or maybe you've realized that you don't really like the taste of an apple, or maybe the skin really bothers you. But regardless of what your feelings are of apples, these are all things that you'll remember the next time that you see one. So it'll be that much easier for your brain to be able to know how to react the next time you see an apple, maybe in the grocery store or when a friend pulls it out at the lunch table. However, in our children that have sensory processing disorder, all of these signals in our brain that is taking in all this information, these signals get crisscrossed and disorganized. So while they're taking in all this information about the apple, when they bring the apple close to their face, their body and their brain perceives that smell as extremely aggravating or maybe even dangerous. So if they think that this apple could potentially harm them, they might throw the apple across the room to get it as far away from them as possible because it could potentially be dangerous to them or their body, or so their brain is telling them. This is what we would call an inappropriate response or behavior. But based off of my explanation I just gave you, I'm hoping that you notice that this is a neurological difference and not a behavioral response. Of course, the neurological difference can result in a behavioral response, and this is where OT would jump in, and we'll talk about this a little bit later. I already touched on some of the components of sensory processing in my apple example. When we're learning about new sensations, we use our senses to take in information about this new information. When we were in school, we learned about the 5 basic senses: sight, sound, smell, touch, and taste. There's a lot of research out there that shows us that there are actually a lot more than just 5 senses that contribute to our learning. The 3 that we are concerned about from an occupational therapy and sensory processing viewpoint are your vestibular sense, your proprioceptive sense, and your interoception sense. Your vestibular sense, in the fewest words, is your body's understanding of where it is in space. So whenever you're moving around, whether you're moving in a linear motion, so forward and backward, or a rotary motion, so spinning, or even if you're just balancing on one foot, if you're standing on an uneven surface or something like that, that is your body's ability to understand where it is your vestibular sense. So in a real life example, this is why I can't go on anything that spins, because I might have a hyperactive vestibular processing system. It doesn't take very much for me to get dizzy because my vestibular processing system is so sensitive. But for some kids, they can't get enough spinning. These are the kids who might really like those rides, or these might be kids who just spin around in circles for fun. I can't even watch kids spin in the gym. That's how sensitive my processing is. But somebody with an underactive vestibular processing system might actually seek out this movement, even in inappropriate times. So again, that might produce an inappropriate behavior. Our proprioceptive sense is our body's ability to understand where it is in relation to itself. The example I like to give to this is people who do yoga or work out regularly and do things, exercises like push-ups, can understand the feeling that you get when you're in a weight bearing position. So like a push-up position or like a downward dog position, and you can actually feel the weight of your body being pushed through your arms and your hands into the ground to hold yourself up. That heavy feeling is your sense of proprioception. In the clinic, the OTs will actually use the words heavy work. That's the more commonly used phrase to describe proprioception. So you can really get proprioceptive input lots of different ways. You may even be getting it right now as you're watching this, depending on what you're doing. If you're sitting in a chair, you might feel the weight of your body pushing into your seat, or maybe the back of the chair pushing against your back. If you're standing, you probably feel all of your body weight being pushed through into the floor. That's your sense of proprioception. In a child who doesn't really have a sense of proprioception, it kind of feels like they're free falling because they're not really sure where their body is because they're not getting that sense of pressure. These are kids who might benefit from a weighted blanket or a weighted vest, or these are the kids who just like to run and crash or who like to throw themselves on the floor just for fun because they're also getting that really satisfying input of understanding where their body is because when they crash on the floor, they definitely feel that pressure. The last new sense that we're going to learn about today is our sense of interoception. And this is our body's understanding of what's happening on the inside of our bodies. So this is how we know when we're hungry, when we're full, or when we have to use the bathroom. Somebody who had an underactive interoception processing system might not understand when they need to use the bathroom. And of course, that would come with an entirely different set of challenges. So when any one of those now 8 senses that we know about are either over or underreactive, it can result in some symptoms of sensory processing disorder. So in general, we might just say that a child is over or undersensitive to a specific stimuli. So some kids are very oversensitive to auditory stimuli like sudden loud sounds, like the fire alarm in school. Or I always think of my brother when he was younger, he was always afraid of the sound of a balloon popping, that sudden, very loud sound. He was slightly oversensitive to auditory stimuli. In general, kids with sensory processing might just be prone to meltdowns, and this could be for lots of different reasons. They might be melting down because they don't know how to cope with the unpleasant stimuli. They might be incredibly anxious or frustrated, lots of different reasons. But in general, kids with sensory processing disorder might just be melting down because they're having a hard time dealing with these unpleasant things that are around them. Kids who have oversensitive oral systems might be picky eaters. So going back to my apple example, if they find even very basic textures like a soft texture unpleasant, they might not want to eat lots of different kinds of food. So they might present as a picky eater. I already said a little bit that anxiety is a factor. When we're constantly around these things that could be aggravating or perceived as dangerous to us, it can cause us to feel anxious. And then in a child who has sensory processing where lots of things can be perceived as dangerous or aggravating, they might be anxious all the time or very often. Children who are undersensitive for auditory processing might look like they're not really listening or that they're not really paying attention, even if they have good hearing. They sometimes can get misdiagnosed as having a hearing or learning disability. Children with ADHD or ADD very often have sensory processing differences. These are children who have undersensitive vestibular or proprioceptive processing. So these are the kids who can't get enough movement and that are constantly wanting to crash into things. This can also manifest as impulsivity or even defiant behavior. We might tell a child, hey, don't go run into that crash pad. It's not safe right now. But if their bodies are telling them, I need to run into that crash pad because I don't know where I am right now, it can look like that they're not paying attention to our directions, that they act impulsively, or that they just don't like following directions and that they're choosing to be defiant. And at first, that could be what it looked like to the untrained eye. But for somebody who's looking for signs of sensory processing disorder, we would know that the child is just trying to get their needs met. And our jobs as the caregiver is to help redirect or guide them to a more appropriate way to get those needs met. Likewise, kids who are undersensitive in terms of proprioception might not be getting enough pressure or input to know where their bodies are. So they might look like they're very uncoordinated, or that they just want to be rough playing all the time. So basically, there are lots of different signs and symptoms of sensory processing, and it really just depends on what aspect of the sensory processing system is causing this child to have challenges in their environment. I want to touch on sensory processing disorder and autism for a second here, because the more that we learn about autism, the more that we understand that sensory processing disorders and autism are very closely connected, because autism is a cognitive disorder primarily. And we already know, or we learned today, that sensory processing is affected by differences in brain chemistry. So very often, children with autism disorder have challenges or differences with sensory processing. However, just because a child has sensory processing disorder, it doesn't mean that they have autism or that they might have autism. Those two are not, the relationship is not exclusive. Likewise, sensory processing disorder is very common in children with ADHD or OCD or other developmental delays, but just because somebody has sensory processing disorder or even sensory processing differences doesn't mean that they have these other disabilities, or that they will even have these other disabilities at some point in their lives. Like I was saying before, I have some differences in my sensory processing, but it doesn't mean that there's something else happening. We all just have different bodies, and all of our bodies choose to react to things differently. If you decide to pursue a sensory processing disorder diagnosis, there are specific criteria that need to be met. There are two different places that we would go to look for this information. The first one is the ICD-10 diagnostic criteria, which is on the internet, and the DSM-5, which is a publication. And both of these work as checklists. There are a couple of different pieces of criteria that need to be met for a sensory processing disorder diagnosis to be warranted. And the criteria is met through the completion of standardized tests and assessment tools. Non-standardized assessment tools are very often used, especially in younger children, because a lot of the information is self-reported or reported by their caregivers. There are also observational scales, which are a little bit more standardized, and it relies on the expert's opinion. So a person like an occupational therapist, or maybe like an ABA therapist, or another professional who works very closely with these diagnoses, would be able to just watch a child play for a certain amount of time, and maybe even present them with certain challenges or aggravating stimuli to see how they respond, and to decide if a sensory processing disorder diagnosis is warranted. Okay, so now I'd like to talk about how sensory processing disorder and behavior are connected, because this is kind of complicated. And like I said, what can start a sensory processing disorder can result in behaviors if a child's sensory needs are not being met, or if they're not able to meet their needs appropriately, or how we would consider it appropriate. So just as a review, our body's input and the way that we learn about the environment is from our sensations, from the 8 senses that we already know about. Our output is our behavior. This is our response to these 8 senses. So if we are having challenges with focus and attention as a result of differences in sensory processing, this could result in an ADD or ADHD diagnosis. If we have learning challenges because we are possibly over or undersensitive to auditory stimuli, so you could see that would result in having a hard time learning in the classroom, being able to pay attention to the teacher because we can't focus and listen to what the teacher is saying. A child might have a diagnosis of dyslexia or auditory processing. Likewise, children who have challenges with coordination because of differences in proprioception or vestibular processing could just be called clumsy, so that's not an official diagnosis. But more official diagnoses of challenges with coordination are dysgraphia, so challenges with handwriting, or dyspraxia, motor planning challenges. Children who are over or undersensitive and just have a general hard time coping or have a maladaptive coping response might get diagnosed with anxiety. So going back to my fire alarm example, children who are maybe auditory sensitive might just constantly be worried about loud sounds happening. The world can be very unpredictable and the world can be very loud. So someone who is sensitive to auditory information might just be a very anxious person, especially if they're outside or somewhere that's loud. Other kinds of maladaptive coping behaviors are OCD. So the example people very frequently think of is compulsive hand washing or obstinate defiance. So children, again, who are just trying to get their sensory needs met might seem like that they're misbehaving for no reason, or after a while, even if they are educated about their sensory processing differences, if they still choose to have their sensory needs met in an inappropriate or ineffective way, then we could diagnose a child with a diagnosis like ODD. Lastly, sensory processing can have an effect on our relationships and how we socialize with others. An example I always like to think about for this is people who are sensitive to chewing sounds. This, I feel like, is something that's gotten a lot of attention, at least in the last couple of years from my own observations in my personal life. People are realizing that there are a lot of other people out there who are very sensitive specifically to chewing sounds. And at first that might sound harmless and not like a really big deal, but if you're so sensitive that you can't even sit at the table as somebody who chews with their mouth open or somebody who chews loudly, that can affect our personal relationship with that person. And that could lead to a whole other bunch of problems. So what appears as a behavioral problem in a child could actually be a sensory processing issue. And we would want to address that to get to the root of the problem so it doesn't result in other challenges. Now, it's important to know that just because we're addressing the sensory challenge doesn't mean that everything else is going to go away, but it definitely could be a huge part in at least mitigating our other challenges. Because if our sensory needs aren't being met, then it's going to be incredibly hard to meet any of our other needs. I'd like to take a step back from talking about sensory processing disorder, and now I'd like to talk about tools to maximize our daily success. And these are tools that are not just for kids with sensory processing disorder, but kids with autism spectrum disorder, developmental delay, or just a kid who's having a hard time getting through a challenging activity. Kids with sensory processing probably understand what it's like to have a hard time doing something that can be really simple. And there are strategies that we can use to help them overcome these challenges. But it's first important to know that even the most basic task, and the example I'm going to use for this slide is shoe tying, can be really complicated. In shoe tying, which is something that we do almost every day, there are so many steps. I think in shoe tying alone, I can think of at least 10 steps, depending on how you want to break it down. But breaking down the task is so important because that is how we can figure out what part about the task is giving us a hard time. And as the caregivers, we can jump in and either do that part of the activity for the kid to make them successful, or we can modify the activity so that way the kid can do it on their own and still be successful at it. That process that I just described is called task analysis. So taking an activity and breaking it down to its most simple steps is task analysis. And then my job as the OT is to come in and to either find a way to make the task easier or to do the part of the task that is difficult for the child. Regardless of what your approach is, it's very helpful often to outline all the steps in the task, sometimes writing it down if the child is able to understand that, or using pictures, so that way the child can follow them. You're essentially making a big to-do list of this one thing. So shoe tying in our example, you're making like a to-do list for shoe tying. So your shoe is on, hopefully. And so first you cross the laces, and then step 2 would be pulling. I could keep going from here. But just like a to-do list, sometimes it's helpful to cross off things as you go. And actually, I very often encourage parents to let the child cross things off of their to-do list because it's so satisfying when we're able to do that and to tell ourselves, I get to cross this off because I did a good job doing this task, or this was really hard, but I'm checking it off now because it's done. And even though it didn't turn out the way I wanted it to, at least it's over now. So to-do lists are a great strategy, And I encourage parents to make to-do lists for, you could do a to-do list just for the morning or for your whole day. It really is up to you as a parent how you want to do it, because what's a to-do list but a task analysis of your whole day? You're basically taking your whole day and breaking it into more manageable chunks. First, I wake up in the morning, then I have breakfast, then I get dressed, and then I get ready for my day. So if you have a lot of errands to run on Saturday, it can seem really overwhelming. But if you write down all of the different places that you have to go, and then you get to check it off after you go to each one, that makes it seem a little bit less scary and more manageable to do in one day. We can help reduce children becoming frustrated if we get rid of the stuff that's difficult for them. And hopefully we'll reduce some of those incidences of meltdowns that we know very often children with sensory processing disorders are more prone to. But regardless of what the outcome is, you'll want to acknowledge the child's effort of trying the task, because lots of times anxiety is a factor, regardless of whether a child has sensory processing disorder or not. So children want to be recognized for their efforts just like we do as adults. I think I read something recently that for every criticism that we give a child, you want to give 8 positive things about whatever they're doing. And I know that number, it's not, a number to live and die by, but it's just important to remember that criticism, while it's helpful, too much of it is not helpful. So it's always important to acknowledge the outcome or acknowledge the effort regardless of the outcome. Another great tool that I use, not just with kids with sensory processing disorder, but also with a lot of kids that I work with, is a responsibility chart. And I like to point out that I did not call this a chore chart. And I specifically chose my words carefully because responsibilities are a privilege, but chores are work. As we get older and we become more independent, we have the privilege of being able to take care of our own bodies. Because when we're young, our caregivers have to do everything for us. And that's okay when we're little, but the older we get, the more annoying that gets, because maybe we don't like that shirt that mom or dad picked out for us and we want to wear the blue one. So having the responsibility of choosing our own clothing is a privilege, because we get to decide what we do when we have autonomy over our own bodies. Sometimes even just understanding why an activity needs to be done can make it seem a little less daunting. So some kids really hate doing laundry. And I say some kids because I know I still don't like doing my laundry, but it is a privilege doing my laundry because I bought these clothes myself and I get to clean them because they're mine. And I'm going to take care of my things because I want to be able to wear them again. And I worked really hard to pay for these clothes. So even though I hate doing laundry, I want to keep my stuff looking nice. It's a privilege to be able to do that and not have to rely on anybody else to do my laundry for me. I know that's not necessarily an example you would use with a younger child, but that's the general idea. Regardless of how you choose to present the activities to your child, it's important to be clear and specific with your expectations. Sometimes saying, you need to do these 3 chores before the end of the day, otherwise you won't be allowed to play with your friend. In that instance, you're giving them very clear expectations. If we don't do this, then this will happen or this won't happen. That way the child is being included. They're not feeling like things are being kept from them. And if they don't end up doing what they were asked to do, you can at least say, I told you that this is what was going to happen. And they might get upset and they might protest, but at least next time you can remind them what happened when they didn't follow directions. So you can say, last time I told you that if you didn't do these 3 things, then you wouldn't be able to play with your friend. So let's remember that and try and get this done so that doesn't happen again. You also, at the same time, wouldn't want to set too many boundaries for a child who is capable of doing the job themselves. So going a little bit back to task analysis, we don't want to give too much help because that can be frustrating for a child as well. So understanding what the child's abilities are and what their own limits are is important, because that can be frustrating and cause a child to shut down as well. And that's something I have to remind myself very often, because as caregivers, we very often want to jump in and just do everything for the child, but it's important to let them do what they can do. A strategy lots of parents like to use is offering incentive or rewards for doing everything that needs to be done. in the first example I gave of doing these three things or not being allowed to hang out with the child's friend, likewise, you could offer an extra incentive. So if we do everything on our list, then you can have extra time with mom, or we can have extra screen time, or maybe for an older child, you could do an allowance. So offering extra motivation. But regardless of however you decide to set up the chart, I think it's important to have the child included in the process in some way. So whether that's picking the order of the way that they do things, or if they're allowed to pick the day of the week that they do a certain chore, or a time of day, or if they're allowed to pick what they're working for, which I find usually to be the most effective, it's important to let the child be included in the process if it's appropriate. That way, the child feels like they have some sort of control over the situation and they'll be more willing to actually do the items on the list. If you are helping out a child complete a task that's new or difficult for them, the way that we give directions is extremely important. The biggest thing that you'll want to do is to be consistent in how you give your directions in terms of the amount of words and the types of words that you use. So with shoe tying, you'll always want to use the same directional cues, because if you're using one word to describe shoe tying one week and then using a completely different word the next week, that can be so confusing, especially for a child who has a developmental or like a learning disability where they are already having challenges perceiving directions. So it's our jobs to be as consistent as possible. It also helps to reduce the amount of words that you use, just to eliminate all of that unnecessary information to help the child avoid being confused even further. At the same time, it's all right to be completely silly and to have fun. I always say if I'm not having fun, then the kid is definitely not having fun unless they like watching me struggle, which most kids don't. It's important to try and think about ways to keep it fun and exciting and different. And I know there are just going to be certain things that might not be fun or exciting or different every time, but that's when you can just use your relationship with your child and just be silly or just kind of joke around. Of course, within reason, you don't want to distract the child too much, but if you notice that a child is starting to lose interest or maybe starting to get frustrated, doing something totally unexpected can kind of be a nice reset. However, if you or the child start to become really frustrated, it's okay if that happens. And actually, I encourage parents to model what it looks like to make a mistake or to become frustrated or to not know what to do. So that way you can show the child what it looks like when you're recovering from that. Because we want to be the perfect examples for our children and we want to do everything the right way so the children know what to do when they're tasked with something. But we don't really focus on what to do when we don't know how to do something. So teaching those skills are just as important as teaching children how to do something. Modeling what it's like to fail and modeling what it's like to ask for help and to how we should be reacting when we make a mistake are all things that need to be learned. And children learn best by watching. So it's also our job to model these things for our children to learn. So when would you want to seek help for your child? There are lots of different times when, if I was a parent, I would want to seek professional help. If you notice your child is missing the developmental milestones, these are available free on the CDC government website. They list them by age and they even break them down by the type of skill. So your gross motor, big body movements, your fine motor, more hand movements, self-help skills like dressing, play skills. If you notice that your child is missing or not, or meeting these milestones later than the website suggests, that would be a sign for me. If your child is having frequent or uncontrollable meltdowns, and this, I encourage you to consider the age of your child. If a parent came to me and they said, my child is melting down every day, but their child was 2 years old, I would say, yeah, I know, your child is 2. That makes sense to me. But if a parent of an 8-year-old came to me and said that their child was melting down every day, I would say, okay, that would be a problem for me. But likewise, if a parent of a 2-year-old came to me and said, my child is melting down every day, but their meltdowns last hours, that would be a concern to me. So the frequency or the ability to come down from a meltdown or the duration of a meltdown would be important to consider, along with the child's age. This kind of ties back to the developmental milestones, but if they're having a hard time playing in terms of interacting with certain toys or interacting with their peers, difficulties using objects like silverware, pencils, difficulty with zippers, buttons, or shoelaces, so our self-help skills, also including feeding, handwriting skills, balance and coordination, troubles with focus and attention, or just general learning challenges or apparent learning disabilities. We know that some of these are signs and symptoms of sensory processing challenges. OT has a really big place in children with these challenges and disabilities. We offer individualized treatment because everybody's body is different. So even though we have lots of modalities and approaches that we use, every treatment session is individualized to be the most effective and to meet the needs of that patient. We have lots of different approaches using different models and frames of reference. Sensory integration, we talked a ton about today, which also ties back to self-regulation, so our just general ability to keep ourselves calm and happy. OT teaches fine motor and gross motor skills, executive functioning, the sequence of a task and knowing when to do what. And we also have strategies to help attention and focus at home and in school as well. Our clinic is currently offering in-clinic and telehealth appointments. I have found telehealth is effective for basically all the same diagnoses that I would work with in the clinic. I've worked on kids with handwriting goals and also with self-regulation goals and gross motor goals and dressing goals, pretty much anything that we do in the clinic, I've also done over telehealth. This is our website where you can go for more information, or if any of the things I talked about resonated with you and you would like to seek an OT evaluation, this is our website and our phone number. This is what we talked about today: the underlying causes of sensory processing disorder, the components of sensory processing disorder, signs and symptoms, how it can look different in different people, what sensory processing looks like when it is a diagnosis and when we would seek out a diagnosis, what the criteria is, how sensory processing disorder can manifest differently in terms of behavior, and some tools to help make some of those challenges a little bit easier, and when you would want to seek help from a professional. Thank you all for your time. I hope that this was informative.